Meanwhile, Congress is working on fighting the coronavirus. Greg Walden, Republican from Oregon, helped lead a panel on the virus. Sir, good day to you. I know you're going home very soon. We're watching a bill signing in a moment here. House and Senate get together, $8 billion to fight this. What did you learn being with the vice president this week?
You know, look, the president and the vice president are all hands on deck. They've got a good team of professionals that are leading this effort. Dr. Fauci, Secretary Azar, the vice president, the FDA commissioner. These are trained, bright professionals who have dealt with epidemics before, have dealt with diseases before. They're taking all the right public health procedures going forward. We have to do our part as citizens. We need to be smart about this and understand and not panic. There's lots we still need to learn about this virus.
There's a lot of fear, too, and a lot of questions. I guess bring us a sense of rationale. The state of Oregon's getting $500,000, I believe, from this. Is that right?
Correct.
500,000. So the question then is, population's 4 million in Oregon.
Right.
Population in California is, what, 40 million? So how do we rationalize what's happening out there?
Well, and I'll take you a step back, Bill. Remember, every year the Congress appropriates money to the states. My own state got several $1 million to be ready for any kind of health care outbreak like this. So there's already a network in place. This enhances that now that we know we have a case in Oregon, actually 3, 1 in my district, 2 in the Portland metropolitan areas. But our local public health care offices and professionals are the ones that are up front. They're dealing with this. As they need more resources, we are committed to getting them to them. The $8 billion that was just appropriated provides all kinds of support, including directly to states. States are going to get what they need. Okay,
so then how do we manage the fear? How do we manage the unknown, sir?
Well, I think first you listen to those who have lived in this environment for a long time. They're the trained professionals who say, look, this is serious, yes, but let's put it in perspective. You have a very low risk of contracting the coronavirus. We're now up over 200 cases, all right? We've had hundreds of thousands of cases of the flu. It too is a virus that circulates. So let's put it in perspective. If you're under the age of 50, you're probably going to get through this just fine. 80% of those who actually get the coronavirus get through it okay. There's 20%, though, you have to pay close attention to, and usually that's the elderly population and those with other issues, lung disease, heart disease, other things. They're fragile to begin with, and this disease really hits them hard.
I imagine that you've learned a lot in your discussions there in Washington. I imagine you'll take that knowledge back home with you on that.
Indeed.
Okay, and what do you tell them now that Congress, the Fed's cut half a point, off schedule? First time that's happened in 12 years.
Right.
Congress is bucking up $8 billion. What do you say to people?
Well, the first thing I say is use common sense. We all can help with this if you use hand sanitizer, if you actually use it and wash your hands and do the things all the medical professionals say. Start there. Second, make sure you've already gotten the flu shot for this year. It will still be effective in 40–45% of people. That will help reduce the number of people who are sick and going into our hospitals and in to see doctors. And third, if you are sick, stay home. Help not spread not only other diseases, but perhaps if you have the coronavirus. Third, we need to get more tests out there so we can determine who has it and who doesn't. The administration, the private sector, the public sector are all dramatically surging now. And you know, you're going to have the ability to test 75,000 Americans by the end of this week. You'll be up over 1 million tests available for individuals that can be tested by the end of next week. They're surging. They're getting those tests out there. So now we can get some relief and comfort and
in the meantime, the market's selling off more than 1,000 points yet again.
They are.
You've got these huge concerts that have been canceled across the country. Right. But big businesses and convention business, they're shutting their doors as well. I mean, is this what we need to do? I mean, we just had our reporter in Seattle, Washington, tell us that large groups are now being discouraged to get together. And by a large group, they mean 10 people.
Yeah, I personally, I think that's a bit much. I'm not going to prejudge. I'm not a doctor or healthcare expert, but I think that may be a bit of an overreaction, quite frankly. And so I would hope we can get some calm. The more understand we get about this, the more understand we get about this, the more we hear from the CDC and others. I hope it'll get back to a better place. But in the meantime, if there is an outbreak, let's be smart. Let's shut down the school for a few days. Let's go in and clean it out, kill the virus, and then get people back together. So we got to be smart about it, but let's not get over the top. tough.
I hear that. Thank you, sir. Greg Walden from Oregon.